This is the video on ADHD. Attention Deficit Hyperactivity Disorder, or ADHD, is a highly common mental and neurodevelopmental disorder typically diagnosed in children. It is characterized by lack of attention, hyperactivity, and impulsive thoughts and actions. Though most children might squirm around or get easily distracted, ADHD shows these symptoms in a higher than normal capacity and can cause stress and problems with functioning at school and in the home. So what exactly is happening in the brain for people with ADHD? Their brains have low levels of norepinephrine, which consequently impacts the levels of dopamine. Since many functional areas of the brain depend on both norepinephrine and dopamine, depleted levels can cause many problems. In general, an ADHD brain has 4 impacted regions. The frontal cortex controls most of our executive functions and also helps with our attention spans and organization skills. Compartmentalization and other association patterns for organization are all found in the frontal cortex. Attention deficits are shown when people overlook details or make easy mistakes in their work, when they struggle to listen, or have problems completing tasks in a certain order. Sloppy work and poor time management are also characteristic to the lack of attention. The limbic system is also a targeted region of the brain regarding ADHD. It plays a role in attention as well, but it is also largely responsible for regulating our emotions. This is why people with ADHD can sometimes act impulsively, as their ability to identify and process such emotions is vague. In children, this can present itself in talking nonstop, interrupting others, or behaving in ways that are intrusive to others. The basal ganglia are responsible for so many of our interbrain communications that deficiencies here play a large role in the manifestation of ADHD. Low dopamine levels can cause the brain to almost short-circuit and make people appear distracted. This makes sense considering their entire communication and processing center is working at a lower capacity. This inattention can result in forgetting everyday responsibilities, like chores or daily routine habits, and over time, causes the person to dislike or avoid mentally taxing activities. The Reticular Activating System, or RAS, is a large communication system that brings information into and out of the brain. Low levels of neurotransmitters here results in all 3 major symptoms: inattention, hyperactivity, and impulsivity. As ADHD patients grow up, their behavior can change as the disorder continues to present itself in different ways. For example, most young children struggle with hyperactivity, and by elementary age, this can cause academic struggles or bring disciplinary action. But as they grow into young adults, the hyperactivity shows less in a physical manner and begins to appear as feelings of restlessness or small, subtle movements like fidgeting or finger tapping. Though the cause of ADHD is not fully known, it is widely accepted that certain risk factors can cause its onset. The possibilities include genes, low birth weights, or brain injuries that can create the deficiencies of norepinephrine and dopamine. Additional risks, like exposure to alcohol and drugs while in the womb, or contact with environmental toxins before or after birth, have all been linked to ADHD cases. Though there are no cures for ADHD yet, there are many treatments that aid in symptom management. Medications like stimulants increase levels of norepinephrine and dopamine. Behavioral therapy can help monitor and therefore adjust or correct the problematic behaviors. And general education for both the parents and patients, like tactics on how to stay organized, better ways to make lists or reminders, and other training programs, help everyone involved. This ends the video on ADHD.